The only question which most of the parents come up with is, हमारा बच्चा ठीक हो जाएगा ना? A child initially presenting with maybe features which have autism spectrum in them might after a few years become hyperactive, might after a few years start having symptoms which are leading him to have a diagnosis of ADHD. So when we talk of neurodevelopmental disorders, let us break it down into neurodevelopment and disorders, right? So when we talk of a child's development, we are talking primarily of two things. One is the growth, which is gaining weight, height, head circumference. The other is development. When we talk of development, we are basically talking about a child acquiring skills. Now these skills are usually, for ease of understanding, divided into areas. The areas are motor areas, use of hand function, developing language skills, developing social and emotional behaviors, and developing cognition or problem solving. So when we talk of neurodevelopmental disorders, these are just a group of conditions in which the brain is either delayed or the functioning of the brain is abnormal, the connections are abnormal, and therefore these disorders are labeled as neurodevelopmental disorders. Now, under these conditions or under these neurodevelopmental disorders, we have what is autism spectrum disorder, attention deficit hyperactivity disorder, intellectual disabilities, learning disabilities like dyslexia. We also have speech and language disorders and some developmental motor incoordination disorders. When we talk of diagnosing neurodevelopmental disorders, one is that the diagnosis is not according to either, you get a blood test done or an imaging done and you come to a conclusion that, okay, your hemoglobin is low, so you have anemia, or you have low thyroid levels and you have hypothyroidism. So these have to be assessed because they are learning difficulties and behavioral difficulties. They have to be assessed in a very different way. When we talk of diagnosing, we want the child to be diagnosed very early on. And an early diagnosis is required or is very essential because, like I said, it is a problem with the maturation of the brain. Now, to understand that, we need to understand that our brain develops maximum or grows maximum in the first 5 years. The brain volume reaches near adult size by the time you are 5 years old, right? Apart from that, there are millions of connections which are being formed in these first 3 to 4 years. The synapses, the pathways are really forming at a very rapid speed at that time. So right at that point of time, if we are able to work with the brain we are able to remodel the brain very effectively, and which is what we call as neuroplasticity. So it is maximum in the first 3 to 4 years of life. And it is not just, like one of my seniors keeps saying, it's not just early diagnosis and early intervention, it is early and appropriate intervention. So you give the right input to the child during these early years, you make the connections, the proper connections strengthening, and you decrease or weaken the connections which are improper. And this leads to much, much better outcomes if we are able to diagnose and intervene appropriately in a child. For a diagnosis, first of all, it is always a multidisciplinary team of professionals which are working in this field. It is not one single person. So if I need to elaborate the people who would be, dealing with or diagnosing a child, the first and foremost is when there are parental concerns, or there are concerns by the primary pediatrician, or sometimes even these concerns can be raised by a teacher. So when the child goes to school, in that environment, the teacher realizes that the behavior is not as appropriate as with the other children of his or her age, or if they are learning disabilities, which again come later on in life. So whatever concerns are there, the first and foremost person which the parents usually approach will be their primary pediatrician. Now the primary pediatrician is the one who is going to see the child, observe the child, maybe perform a developmental screening test for the child, a short screening test. And then if the primary pediatrician feels that this child requires further evaluation, there is some delay or some deviation in development, then he or she refers this child to a specialist. Most of the developmental problems are now dealt with developmental pediatricians. So we are specialized in dealing with child developmental disorders, right? The role of the developmental pediatrician is to assess the overall development of the child. That person then decides what further assessments are required, what further evaluations, what further diagnosis is required, diagnostic tests are required to then come to a final conclusion or diagnosis, right? Now, in this, a full team of professionals is required. So depending on the child, there could be a pediatric neurologist who is involved. If we feel that there is a problem with the child, there might be seizures associated. So in that case, we take the opinion of a pediatric neurologist. We might need an ENT person for hearing. We might need an ophthalmological evaluation to check for vision. Apart from this, there are a team of professionals who are qualified or who have specialized to train and deal with children with developmental disorders. Now, herein come in the clinical psychologists, the occupational therapists, the physiotherapists, and the speech and language pathologists. They all have their own roles. They will all assess their specific areas of concern and then come up with the diagnosis. Once developmental pediatrician has assessed and said that, okay, this child needs further evaluation in these fields. Now, depending on if the child has mainly motor problems, then the child is evaluated by a physiotherapist. If the child has problems with behavior, with understanding, with responses, the child is led to an occupational therapist who will get in the child to start responding, to start imitating, to start interacting with humans, right? The speech and language pathologists will work with the child's language, not only the speech, but also the receptive part of language. When we talk of receptive part of language, we are basically talking about the child responding to the other person. Like if I ask the child, can you go switch on the light please? The child is able to go and switch on the light. If I say, okay, say bye, the child is able to say bye, right? So that is response. So both components of a language are to be dealt with, right? And then we have the behavioral interventionists, and we also have special educators who work with children who have intellectual disabilities or learning difficulties. It is a huge diagnosis. It is overwhelming. Most of these conditions do not have, if you have a disease and you have a cure for it, most of these diseases require a lot of interventions, a lot of therapies, and they are long term. So it is definitely something which plays on the parents' mind, and most of them would or definitely try to go for a second opinion. I would suggest go for a second opinion only if you feel that all your concerns, initial concerns, have not been addressed, or if you feel that the management plan which was given to you is not aligning to your child's needs, your family needs, the logistics of how far you stay, the financial conditions of your family, the support you have from your family, all these should be taken into consideration when you make the management plan of a child. If you feel that these are not happening, then it is a good idea to go for a second opinion. Also, I strongly recommend parents to go for another opinion if they have not received proper documentation. Whatever assessments have been done, whoever has made the reports, the parents should know that this is what has been done, that whole documentation should be with the parents. This is the management plan, this is a long-term goal we have, these are the short-term goals we have. If that has not been provided to parents, I would strongly suggest to go for a second opinion. First and foremost is, even if you are going for a second and third opinion, I would suggest parents to start working with their children. Most of the time what happens is, just in taking opinions, just in trying to have someone say that no, your child is okay, because that is what all parents want to hear at the end of the day, they tend to waste a lot of time. And as we have already emphasized how important it is that the child should be intervened as early as possible. So a child who has been diagnosed or has been told that your child has this problem at 2.5 years, the parents tend to keep roaming around 3.5 years till 4 years of age, and that time is very precious. So start working with the child as soon as possible. Get your child enrolled in early intervention programs. Get your child to have a management plan. Okay. Now the therapies or the interventions which are available should be evidence-based, should be research-based. Do not go for any therapy or any interventions which have not had any scientific basis to it, So out of the therapies which have been proven to work is mostly occupational therapy, behavior therapies, language therapies, applied behavior analysis. So all these therapies and physiotherapy, definitely. All these therapies have evidence behind them that they work very well when you work with them with the right child. See, when we are speaking about working with the child, initially we have to be very intensive. We cannot give the child breaks. The parents have to gear up, and that is why we keep telling the parents that you take small breaks, you have parent support groups for yourself, you take support from your extended family, reach out to people who are willing to help you, because it is not something which you have a lot of enthusiasm in the beginning and you just go all out. There are parents who also say that we leave our jobs and we'll just work 24/7 with our kids. That doesn't sustain. Persistence is the key. You have to go on and on working with your child till you reach a point where you know that now my child is well adjusted in school, my child is well adjusted with his neighbors. If I take the child to a park, or if I take my child to a play area, I do not have to keep wondering whether my child may act up. If you have achieved this, if your child is able to go to his nani's house or mama's house or mausi's house and stay there without you, these are the parameters which then you can, slow down a bit. But till these are achieved, you have to be persistent and consistent. First of all, to have goals, you have a long-term outcome, you have short-term goals. Now, if you're not able to achieve those short-term goals also, then you start wondering why this is happening. When you start thinking about why this is happening, then you take not into consideration only the child or the child's therapist. You also take into consideration the parent involvement. You also take into consideration the family atmosphere. All these things, the input of the school, the input of the community. It is not just a child with the family who is working or the therapists who are working. The school should be equally involved, the teacher should be equally involved, the community should be equally involved. If all of us work together and around this child and his parents or her parents, we will definitely be better off. Thankfully, the Government of India, we have this RPWT Act, which is Right for Persons with Disabilities Act of 2016. Now, in this act, we have included, initially it was only intellectual disabilities, or at that time it was called as mental retardation. Now we have also included autism spectrum disorders. We have also included learning difficulties and disabilities in it, right? So with this whole spectrum, if your child is diagnosed with any of these neurodevelopmental conditions, the process is that the child has to be assessed in a government facility. Once the diagnosis is made, there is a card which is called as a UDID card, which is a unique disability identification card, right? Now, once that is made, you have a whole list of accommodations and concessions available to your child. And these also include financial considerations. So there's this health scheme called Nirmaya, I think. And all these, this whole information is available on the UDID site, which is called the Swabhalambam site. So at that site, you can go and register your UDID, and then you get this whole list of, you have educational, concessions, you have concessions in your workplace when you grow up, you also have financial help. Most of the 3-tier cities in India, a lot of 2-tier cities also, they've all come up with what we call as child development centers. So basically, this is the name which has been given, and this has a whole team of healthcare professionals, usually headed by the developmental pediatrician. We have clinical psychologists, we have speech and language therapists, we have occupational therapists, physiotherapists, and special educators. Now, this whole team being in one place really helps the parents, because the child doesn't have to go here and there. Also, there is a coordination between this whole team. So when a therapist feels that this child requires maybe this therapy, or this child now doesn't require this therapy and requires another therapy, there is an interplay which is happening among all these professionals, and the best possible therapies, the best possible interventions can be planned for that child under one roof. If you do not have access to child development centers, there are very good online programs for parent training. Also, there are some centers which do provide online sessions for children. So, I get a lot of patients in Apollo who do not have access to these child development centers. They come from very remote areas, and therein my only option is to then give them some these platforms where they can train themselves, either through online training, or they can reach out to centers which are providing online sessions at Sunshine, or I would say the CDCs who are really working effectively. The one thing which stands out is that there should be a regular follow-up. There should be regular documentation. There should be some outcome-oriented programs. You cannot say, you have to take that responsibility and onus as a professional, that at the end of the day, when we have worked with your child for 3 months, 6 months, 1 year, we have helped the child become more adaptable, become more functional, become more learned. We cannot say at the end of 1 year that this is a lifelong condition and you have to live with it. Then we have failed. So I think that is the one point where I would say that, at Sunshine, we are really working with having a good, robust follow-up, having an outcome-oriented approach, and keeping the parents in loop. The parents are always there, they can attend the sessions or see the sessions. They can ask or reach out to the professionals at any point of time.